Belinostat Solution, Reconstituted, Recon Soln, is a medication used to treat peripheral T-cell lymphoma, PTCL, a type of cancer. It works by slowing down or stopping the growth of cancer cells. It is important to take this medication as prescribed by your doctor. The dosage and timing will depend on your specific condition, so be sure to follow your doctor's instructions carefully. Before starting to use Belinostat, make sure to read the patient information leaflet from your pharmacist. This medication is typically given by a healthcare professional in a clinic or hospital. It is injected into a vein as directed by your doctor, usually once a day on days 1 through 5 of a 21-day treatment cycle. The injection is given slowly, usually over 30 minutes. If you notice any redness, pain, or swelling during your injection, make sure to inform your doctor or nurse right away. The dosage of this medication is based on your medical condition, body size, lab tests, and response to treatment. To get the most benefit from Belinostat, it's important not to miss any doses. Remember to mark the days when you are scheduled to receive treatment on your calendar to help you remember. If you experience nausea, vomiting, or diarrhea, let your doctor know. They may prescribe medications to help manage these symptoms. Eating small meals, avoiding food before treatment, or limiting activity may also help reduce these effects. You may also experience tiredness, headache, constipation, decreased appetite, or dizziness. If any of these symptoms persist or worsen, contact your doctor or pharmacist right away. While using this medication, you may experience serious side effects. However, your doctor has prescribed this drug because they believe the benefits outweigh the risks. Your doctor will closely monitor you to decrease your risk. Contact your doctor immediately if you experience any serious side effects such as easy bleeding or bruising, swelling of the hands, ankles, or feet, or symptoms of anemia like severe tiredness, pale skin, or shortness of breath. This medication may lower your ability to fight infections, making you more susceptible to serious infections or exacerbating any existing infection. Contact your doctor immediately if you notice any signs of infection such as a persistent sore throat, fever, chills, or cough. Belinostat may rarely cause serious liver disease. Seek medical help right away if you experience symptoms such as persistent nausea or vomiting, loss of appetite, stomach or abdominal pain, yellowing of the eyes or skin, or dark urine. In some cases, Belinostat may cause side effects due to the rapid destruction of cancer cells, tumor lysis syndrome. To lower your risk, your doctor may prescribe additional medication and advise you to drink plenty of fluids. Contact your doctor immediately if you experience symptoms such as low back or side pain, signs of kidney problems such as painful urination, pink or bloody urine, or changes in the amount of urine, or muscle spasms or weakness. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, contact your doctor or pharmacist. Before starting Belinostat, make sure to inform your doctor if you have any allergies or if you have a history of infections, kidney disease, or liver problems. Belinostat may increase your risk of getting infections or make existing ones worse, so it's important to avoid contact with anyone who has a contagious illness. You should also let your healthcare professional know if you are planning to get any vaccinations, and be cautious with sharp objects and activities that could lead to injury while taking this medication. Belinostat can cause dizziness, especially when combined with alcohol or marijuana, so it's important to avoid driving or operating machinery until you know how this medication affects you. It's also crucial to inform your doctor about all the medications and herbal products you are using, as well as any plans for pregnancy. If you are a woman, reliable forms of birth control should be discussed during treatment and for 6 months after your last dose. For men, it's important to discuss reliable forms of birth control during treatment and for 3 months after the last dose. Additionally, it's best to avoid breastfeeding while using this medication and for 2 weeks after stopping treatment, but be sure to consult your doctor before making any decisions. Drug interactions can affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare professional before making any changes to your medication routine. If someone has taken too much Belinostat solution and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. Before starting Belinostat Solution, Reconstituted, Recon Soln, it's important to undergo lab and/or medical tests, such as complete blood counts and kidney/liver function tests. These tests should also be done regularly while using the medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. Make sure to take Belinostat Solution, Reconstituted as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. This medication, Belinostat Solution, Reconstituted, Recon Soln, is given in a hospital or clinic and will not be stored at home. It is used to treat a certain type of cancer known as peripheral T-cell lymphoma. The dosage and timing of this medication will be determined by your healthcare provider based on your medical condition and response to treatment. It is important to follow your healthcare provider's instructions carefully. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.